How does sickle cell increase hemorrhagic stroke risk? Have you ever wondered how sickle cell disease can lead to an increased risk of hemorrhagic stroke? Sickle cell disease, or SCD, is a genetic condition that affects the shape and function of red blood cells. Normally, red blood cells are round and flexible, allowing them to move easily through blood vessels. However, in SCD, these cells become rigid and take on a sickle shape. This change can lead to various complications, including an increased risk of hemorrhagic stroke. One of the main ways SCD raises the risk of hemorrhagic stroke is through damage to the blood vessel walls. The sickled cells can get stuck in small blood vessels, obstructing blood flow. This blockage can cause tissue damage due to a lack of oxygen. When blood flow is disrupted, it can lead to inflammation and further damage to the blood vessels. Over time, this damage weakens the vessel walls, making them more likely to rupture and cause bleeding in the brain. Additionally, the sickled cells tend to stick more to the walls of blood vessels, which increases blood viscosity. This thicker blood flows more slowly and can promote the formation of clots. While these clots can lead to ischemic strokes, the underlying damage to the blood vessels also contributes to the risk of hemorrhagic strokes. Chronic anemia, a common issue in individuals with SCD, can further complicate matters. Anemia leads to increased cardiac output, meaning the heart has to work harder to pump blood. This increased effort puts additional stress on the blood vessels, raising the likelihood of injury and rupture. Moreover, SCD can lead to increased activation of platelets, which are cells that help with blood clotting. This heightened clotting activity, combined with the narrowing of large cerebral arteries, can create abnormal blood flow patterns. These patterns can increase pressure on the vessel walls, making them more susceptible to rupture. In summary, sickle cell disease raises the risk of hemorrhagic stroke through a combination of factors. The damage and weakening of blood vessel walls, abnormal blood flow, increased clotting activity, and the effects of chronic anemia all play a role. Understanding these processes is crucial for monitoring cerebrovascular health in individuals with SCD. Preventive measures, such as regular screenings and blood transfusions, can help reduce stroke risk. However, while we have established methods to prevent ischemic strokes, preventing hemorrhagic strokes, especially in adults, remains a challenge. Always consult healthcare professionals for personalized advice and management strategies.